Hello, my name is Patricia Larcón. Is my topic that we are going to discuss is the role and impact of cooperative outreach in diabetes education self-care. Definition: diabetes is a semi-chronic degenerative disease of a heterogeneous nature with variable traits of hereditary predisposition of which the participation of various endocrine factors. Self-care can be defined as the practice of the person developing action for their own benefit in the maintenance of life, health, and well-being. Since to be passed in relation to care and guidelines indicated by health professionals being directly related with the social, economic, and cultural aspect in which the subject inserted.
Education about type 2 diabetes is really important because you want an informed patient that you can have a dialogue and a conversation with. And if the person doesn't know anything about diabetes, its management, or the risk of complications, then it's very difficult to move from that to efficient management. So I think it's really important that the patient has some basic knowledge about type 2 diabetes. Type 1 diabetes is particularly important as well for things like carbohydrate counting and the general day-to-day management of type 1 diabetes. Well, it's hugely important because if you're starting anything that's new to you, you want to have some basic knowledge. And the education course is going to give you that basic knowledge. And I find it's really helpful when people have gone there and they've learned along with their peers about whether it's type 1 or type 2 diabetes. They come back to you enthused and knowledgeable about the situation, and then you can have an informed debate and conversation with them.
Nutrition application. 1. Make better decisions about diabetes. 2. Work with your healthcare team to get the support you need. 3. But the glucometer. Understand how to take better care of yourself and others and still you need to. Be more physical active. Know your blood sugar level. Know how to take your medication better. Solving problems and dealing with the emotional aspects of diabetes. Reduce the risk of other health problems. allows me to adjust diet with exercise and insulin dose. In advance, I know how my glucose is at night. Time of diet included at night. Comes the designs in the spans. It's difficult to demand in the balanced diet and exercise. I need to controlling manually the glycemia and the throughout the today.
Father of two, Sean Kaplan has diabetes.
You got the joker.
But his high blood sugar wasn't coming under control with the standard treatment of metformin, a pill that helps your body make less sugar and do a better job of processing sugar. And he was having side effects.
Didn't really feel good most of the time when I was on metformin. The problem was it did a number on my stomach.
His doctor added a new medicine, Invokana, a relative newcomer.
It's easy to take. It's just one pill a day, and it's turned out well.
The customary pills for type 2 diabetes include drugs that help your body process sugar and make more insulin. 3 medicines in a new class have been recently FDA approved. They work by acting on the kidney. You simply get rid of excess sugar in the urine.
It's a completely different path of action.
These new medicines can be used alone, but typically they are add-ons. To be a good candidate, metformin alone isn't doing the job. You have some weight to lose, you have normal kidney function, and you can keep hydrated. Dehydration and increased gynecologic and urinary infections are risks.
Maybe at night I'm up, 1 or 2 extra times to use the bathroom.
Dr. Purnima Rao considers it for half her patients.
With the new medications, they can be expensive. I think the makers do have certain discounts and things like that we try to use as much as possible.
The cash price of these drugs is high. The co-pays are somewhat high, but they're affordable.
Sean says getting his long-term blood sugar test from 14.1 down to 7.7 with an ultimate goal of 6.5 is worth it.
I have 2 little girls. I'm not tired all the time. Spend more time with them and just feel a lot better. I'm still not where they want to be, but I'm real close to it.
I'm Dr. Maria Simbra, KDKA TV News.
Asian player in Ecuador. Ecuador in started carried out 28-19. In the result showed that balanced family functionality provides self-care. They shortened the treatment interpretation time and the further utilization of level of self-care in the province, the film said. With 55 parts for the self-care, Ecuadorian families have their own unique structure.
And it is exclusively related.
Conclusion. The self-care of the painting with the value of the being reflected in the present research. Revealing that the hard habits and behaviors of the sample are considered of the indicator of the lifestyle consistent with the pathology.